Oh, they say money talks, but all mine says is bye.
Bonnie Hall remembers her mum Susan as a fun-loving and gentle woman. Susan Tassin was in good health, but on Tuesday she started complaining about stomach pain, and so Bonnie took her to the emergency room at Royal Inland Hospital.
You know, what a place to die. Devastating.
Hall says the emergency ward was full of patients with only a few nurses on staff. She says they sat in the waiting area for 6 hours as her mother's pain increased.
And I know there were a couple of times where my mom said to me, you know, should we just go? And I said, you know, oddly, eerily enough, I said, you know, maybe we could go, but if something happens, God forbid something happens, that we are here and they can do something if something does.
But then Hall discovered her mother had suddenly died in the waiting room. The exact details of what happened remain unclear as health officials have declined to comment due to privacy issues. Royal Inland Hospital is facing a staffing crisis as it deals with an increasing number of COVID patients during this fourth wave. A Kamloops doctor says the emergency ward has lost 20 of its 80 nurses because of the stressful working conditions, with another 20 shifting to casual work.
This is the worst I've ever seen it. And it's the demoralization of the staff that I think is the most frustrating. We're losing really, really good nurses.
BC's health minister says there will be a full and comprehensive review of Tashin's patient care at the hospital by the Health Authority and the Patient Care Quality Review Board. As for Bonnie Hall, she says her mother's case should serve as a wake-up call. She's calling on the province for a major reform of the healthcare system.
This kind of thing needs to not happen again. And that's the most powerful thing I think my mother would have wanted from all of this is, you know, can we fix it?
Brady Strachan, CBC News, Kamloops, British Columbia.